So my name is Brian Westerberg. I'm the current director for the branch for global surgical care at the University of British Columbia. It's my honor to have with me here today the Honorable Senator Dr. Gigi Osler. It's a mouthful. I don't know which one of those honorifics to use with you, Dr. Osler. Um, Nonetheless, I know you well, but I think many of our listeners probably don't know you very well. So I have a brief bio that I think is worth reading through. So the Honorable Dr. Gigi Osler is an internationally renowned otolaryngologist or ear, nose, and throat surgeon. She's an assistant professor at the University of Manitoba, and she's a dedicated advocate for equity, diversity, and inclusion. In 2018, Dr. Osler became the first woman surgeon and first racialized woman elected president of the Canadian Medical Association. During that role, she led the development of the CMA's first ever policy on equity and diversity. She's been the president of the Federation of Medical Women of Canada since 2021, the chair of the Canadian Medical Forum since 2020, and co-chair of a virtual task force since 2019. Dr. Osler was born in Winnipeg to immigrant parents from the Philippines and India. She serves as a role model and research supervisor and mentor for Filipino and other racialized medical students in Manitoba and across Canada. She volunteers annually to train other surgeons in Africa, although her current roles as senator may interfere with that, but she's been a key voice in raising awareness of the health impacts of climate change in Canada as well. So she has also been the recipient of numerous honors and awards, but I think at this point it suffices to say that she's highly accomplished, and I will not list all those for you. So thank you, Senator Osler, for joining us today.
Thank you very much for having me. I've been looking forward to this discussion for some time because I think for anybody interested in providing care globally, and in particular global surgical care, knowing what to do and how to do it is something that we don't often talk about. So I'm hoping this will be an informative discussion for people.
Great. Looking forward to it. Can you start off just by telling us a little bit about your journey and how you ended up in medicine and in sitting in Ottawa?
Oh, okay, that's a big question. Medicine. So I come from a medical family. My mother was a nurse. She was from the Philippines, came to Canada in the mid-1960s as one of the first waves of Filipino immigration to Canada when there was a large recruitment drive for healthcare professionals, particularly nurses. So she came to Winnipeg. My father was from India, and he was a physician. And they met in Winnipeg, worked at the same hospital, married, started a family, and both of them served as my role models. And in particular, my father as an inspiration to go into medicine. So I really started thinking about medicine in high school, around the time when you have to choosing the courses that you're going to take. So, chemistry, more science-based courses, which then lead to the pre-med courses that you take in university. Fast forward through medical school, through ENT residency, through practice in Winnipeg as an ENT surgeon. I had always thought my life and career would finish up in medicine and in surgery. But lo and behold, a series of different opportunities came my way, opportunities for physician leadership at the provincial level, national level, which then led to my appointment to the Senate of Canada in September 2022. And then I was sworn in October. So it's been a bit of a whirlwind ride. It certainly is not the career path I had imagined when I was starting out in medicine, but it's one that I don't regret, and really am excited to see the impact I can have on medicine, healthcare, and on Canada in general.
And then the global surgical care in particular, how did that come about? What inspired you there? What led you down that road?
Probably around 2010, 2011, my two kids were a bit older, and I started exploring opportunities to serve and give back as a surgeon. And truth be told, I'd actually looked into MSF, Médecins Sans Frontières, or Doctors Without Borders, to see what types of physicians and healthcare professionals they were looking for. And they were not looking for ENT surgeons. That then led to me getting involved with a fellow Winnipeg physician's global health trips. And so we did a trip to Vietnam in, I'm going to say maybe 2011, 2012. And after that, it was around the time I was able to meet and connect with Dr. Westerberg, learn about the work he was doing in Uganda. And then a few years later was able to start going on some of the annual mission trips Dr. Westerberg and other ENT surgeons were conducting. Incredibly insightful, a lot of personal and professional growth, and really expanded my thinking of how I and how we as physicians and as surgeons could contribute to better, safer, higher quality surgical care around the world.
Yeah, I'll circle back to that point in a minute. But what I wanted to ask, you are a graduate of some of our program at the University of British Columbia. When you first started your travels to low resource settings, you didn't have that background. Do you think it's important to have that training? And if so, how do you think it helped you in some of your subsequent trips into low resource setting?
You're quite right. I did my first trip to Vietnam without having any real formal training in global health, global surgical care. So there's a lot of on the ground learning and preparation. Around that same time, and I think I know it was 2012, I first started taking some of the global surgical courses offered through UBC. And I think I started before the certificate course was fully formalized. And that led me to really understand how important it is to go into global health work, global surgery in particular, if you are doing in-country care with more than good intentions. Because I think a lot of people who embark on this work go in with good intentions, wanting to do more, wanting to give back, wanting to help others. But good intentions are not enough. And that's one really important learning I got from some of the early global health courses. And I'm sure it's one of the courses still in the certificate. In particular, one of the modules on disaster relief and humanitarian relief, and how there's always a rush to go in and help. But if you don't have the framework and the governance, and it's very easy to want to go into a country, particularly where there's been a humanitarian disaster, to help. And it's easy to do more harm than good. And they used many good examples, and Haiti being one of them. And so one learning, apart from the good intentions, is not enough, is the motto of nothing about us without us. And that's a motto that disabled people's organizations frequently use. And that speaks to the need to include the people who are being affected, impacted by the work that you're doing in all stages of whatever work it is that you are doing. And so that nothing about us without us is yet another learning from the course, that I see is sometimes overlooked when people think about doing global health work, and that nothing about us without us shifts a lot of the power and decision making from, we'll say, the global north to the global south. And it is learning about the power differentials in the work that's being done and how to meaningfully shift that power so that any work that is being done in country or out of country empowers, builds capacity, and truly has more meaningful and lasting impact in the country that you're working with.
Mm-hmm. So if I can paraphrase some of what you said, sort of that cultural awareness, and you come from a Filipino and an Indian background. Do you think that shapes your experience to some extent, and does it somehow make it easier for you, do you think, in some respects? I guess I'm speaking as a white man going to Uganda. I often I never feel unsafe, but I notice my difference when I'm in Uganda, which must be similar to the way an African feels when they're in Vancouver to some extent too.
So in different countries, are you saying that you feel more safe or less safe?
No, it's not a safety issue. It's being aware of the differences, I guess. And being cognizant that I always say one of the best things you can do for your children, coming from a person who has no children, is to take them to another country and ideally have them study in another country. I think you learn far more by being in different places than reading about it. And I sometimes think if people did that more, it would go farther for improving global surgical care than many of the other things that we did. So I guess it's those differences and being aware of those differences and how they impact your interactions with people. And how that might have influenced you with your background of two different cultures in your parents makes you more astute, more aware of those issues, I think.
It's an interesting question, and I think we could have an entirely separate podcast to discuss that. And I think what you're touching on are a lot of different intersectional characteristics. So, I've got an intersection in being a person of color. I've got an intersection being a woman. And to answer your question about does that make me more aware or hyper aware of things, also consider immigration status as well as another intersection. So I was born in Canada. I didn't immigrate here when I was a certain age. So I've grown up knowing the Canadian healthcare system. Certainly if you are an immigrant to this country, your experiences from your home country would be different experiencing the Canadian healthcare system. So, I certainly know, and we've traveled together, and certainly being a tall white man in an African country, especially in that professional setting as a physician, I suspect you would garner that immediate attention and respect with whatever you say a little bit more differently than perhaps some others. Now, having said that, I think I've always, I've not encountered frank disrespect, but you and I know different countries, different contexts, different cultural contexts can sometimes influence how we as surgeons from high-income countries are perceived. And so, if you're a Canadian surgeon, oh, that's fantastic. This is what Dr. Osler says we need to do. We'll do that. But I think there's different levels of privilege that comes with that, where I'll say probably you being you tall white man in the country, always a leader of our delegation, would automatically come with slightly different, higher level of respect, acceptance. It's an interesting concept to explore.
Yeah, no, and our colleagues in Uganda have become close friends for both of us, and we've sort of grown beyond that, I think. But when I first started going there, I always sensed that there was the way they were with me, which wasn't the way they were necessarily with other people, and it sets up a barrier in some extent, to some extent. And I don't know how this got about me, but anyway, let's shift
Well,
there.
you know what? Before we go on to the next topic of discussion, I think what you've just raised is an important point about developing trust. And developing trust and truly partnering with the people in country that you're going to be working with. And what you're speaking to is the trust that has been developed over the years, certainly because you've been going to that same country for many years before I joined in on the mission trips. But you've been able to develop trust with our partners in country that has enabled the work that we, and when I say we, I mean, the high income country doctors and the doctors in country, to really develop a more meaningful, impactful, sustainable change to care that they're providing to their patients. And we've spoken about it. I know you and I have spoken about it with our in-country partners in Uganda. I've spoken to them about it separately. And it is that trust that has developed that has allowed the relationship to really flourish and develop. And they've had other folks come in, other universities, other hospitals come in, and they have not developed that trust with them, either in that they were fly in, fly out, fly in, brought in all their own personnel, didn't meaningfully partner, didn't build anything sustainable. And that is, I think, a key component of truly doing impactful global surgical work is developing trust with the partners that you're working with so that the partnership can truly grow beyond even what the initial terms of reference or goals of the mission trip was.
It makes it that much more rewarding too. Can I circle back to something you alluded to earlier? It's oft quoted Margaret Mead saying about never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. What do you see as our role as medical professionals, taking off your senator hat, putting on your doctor hat at this point? What do you see as our role as medical professionals, surgical professionals in healthcare in terms of advocacy? It's kind of a loaded question, I know, but I'm curious to see what you think about it.
I often talk about how as physicians, we must be advocates for our patients, be advocates for health, be advocates for health care. So advocate on multiple different levels. And I'm not calling on everybody to go run to be president of the CMA or run for elected office, although if one wanted to, I think there are incredible opportunities there. But as surgeons, we're Royal College trained. We're all familiar with the CanMeds framework. And so within the CanMeds framework, that role of health advocate is probably one of the least talked about, least intentionally taught and communicated roles. And yet, certainly over the last few years with the pandemic and the strain on the healthcare system, I have seen more physicians rise up to embody that role of health advocate. And I would say that we are health advocates every time we have an interaction with a patient. Every time we have an interaction with a healthcare colleague, and just even over the water cooler or in the hallway, talking about, well, what can we do to make things better in this department, in this hospital ward? You're advocates every time you communicate with your healthcare organizations. And some people are health advocates out in the media and on social media advocating for systemic healthcare system reform. And I think if you think about that slogan that I talked about, the nothing about us without us slogan, we should think about that as we see this increased emphasis on the stress, distress in the healthcare system. We as physicians need to be part of those discussions in rebuilding, reforming the healthcare system. So I think being an advocate is core to what we do if we truly want to make health and healthcare better in this country.
Mhm. Yeah, the follow-up question is what Canada should be doing, but I sometimes think that that's an irrelevant question. I think the better question is what we, you, I, and our colleagues should be doing. It's where the boots on the ground. So
Yeah, and I would say to that, think about advocacy on sort of micro, meso, and macro levels. We all
mhm,
do it on those micro levels, on those daily interactions. I would say to you, every interaction you have with somebody in the public, when they know you are Dr. So-and-so or nurse so-and-so, those are opportunities to be a role model and advocate for the
mhm,
profession, for health and healthcare. Meso level is that what we do boots on the ground in the operating room, on the ward, at department meetings. That macro level may be at the regional level or at the provincial or federal level. But there's opportunities at every level and every single day of our lives to be an advocate. Does
mhm.
not have to
Yeah,
be a formalized position.
yeah, often very effective opportunities to those spur of the moment things too. Senator Osler, I'm very conscious of your time and how busy you are. I don't want to take up any more. I really want to thank you for taking the time and speaking today. It's been a real pleasure chatting.
Thanks for having me on.
Great, thank you.